It is an absolute privilege to be the first to welcome you to the inaugural A.J. Anderson Foundation and Florida Institute for Pediatric Rare Disease Conference this morning. And as I look at this room, it is absolutely amazing and humbling to see the outpouring of support and participation in this first annual event that's uniting some of the most brilliant minds in genomic medicine, not just here in Florida, but from around the country and even other parts of the world.
Rare diseases test our healthcare systems, our scientific capabilities, and our collective compassion. At the same time, they inspire innovation, collaboration, determination, and hope. At Florida State University, we are proud to support the Florida Institute for Pediatric Rare Diseases and the Sunshine Genetics Initiative as part of our broader commitment to advancing precision medicine, expanding access to care, and bringing together clinicians, scientists, educators, policymakers, industry leaders, and patient advocates around a shared mission.
The Florida Institute for Pediatric Rare Diseases was established about 2 years ago with a simple but bold vision to bring together clinical care, genomic diagnostics, research, education, and emerging therapeutics into an integrated ecosystem focused on children and families that are dealing with rare diseases. It is about shortening the diagnostic odyssey, enabling earlier intervention, and ultimately creating a healthcare system in Florida that is more proactive and that is accessible to every family.
I will say that when I got the email saying, would you like to come, fly over from England and come speak, it took me exactly 1 second to say yes. Because what you're doing is amazing, right? Florida and what the folks in this room are doing is absolutely amazing. And you are really leading the way for the whole United States. And so what I'm going to talk about today is a program that's going on in England where we're screening, like you heard, we're screening 100,000 newborns and looking for treatable conditions. And when we find that condition, we call up the mom and dad and have them come in and get that child treated before they get sick.
I have to say, having been in human genetics for a number of decades now, this is the most collegial, cooperative group of people and activities I've ever seen. Human genetics has a history of healthy competition between individual investigators, and it's always been the intent in the state of Florida that this would be a public-private partnership collaboration between academic institutions, other nonprofit organizations, and hospitals and industries, because industry has a lot of the expertise, technical knowledge that we need to succeed in this.
Well, honestly, what that treatment means to me is it will change my life forever, because this has been the hardest thing I've ever had to deal with in my life. Losing my ability to walk, it's the hardest thing ever, so that would mean the world to me if all of us come together and make this work out. Very grateful to be part of this. I'm grateful to be here with you guys today, so thank you guys for all that you do. It means the world.
Thank you. Thank you.